On the topic of homelessness, it's a complicated a proposition to even discuss, but joining us, Will Hummel, Executive Director, Arizona Public Health Association. It's good to meet you in person.
Yeah, we've been on the phone a lot, but this is the first time in real life.
The issue of homelessness, it seems like we are beginning to break into segments the problem. There are people that want services and they want transitional housing. There are people that are considered service resistant. But there's another group that you think or you believe is underappreciated, kind of ignored. What is it?
People with a serious mental illness. So that means stuff like schizoaffective disorder, schizophrenia, sometimes bipolar disorder. So that's a constellation of mental illnesses that really require intensive treatment, and not just psychiatric treatment, medications and so forth, and case management, but also supported housing. If you don't have a stable environment, if you have a serious mental illness, maybe you got your meds, maybe you have a good psychiatrist, maybe you have case management, but you don't have stable housing, you're unlikely to be able to stay on those meds, and they tend to then circulate from homelessness to being arrested, to being incarcerated, to having long-term hospital stays, and that population is at really risk of really bad outcomes, but they're also really expensive because all of those other costs in the healthcare system.
Isn't it also true that people that are suffering with serious mental illness many times are disruptive in shelters and other places, and that's why they end up in this cycle?
Yeah, sometimes, but not all of them, and depends where you are in your med cycle. So, right. So once you find the right medication and then you can get them into stable housing, then those behaviors that you're describing can often be resolved.
Right.
And so it's about getting the right kind of treatment. But yes, some of them.
How big is the issue? How many of the people that we encounter, that we see that are unhoused, what is the percentage? How many of them are suffering from serious mental illness?
About half. So we have about 70,000 people in Arizona with a SMI designation, serious mental illness designation. 12% of them had experienced homelessness last year. So that's 7,500 people with a serious mental illness that are homeless. The point-in-time survey of all the persons experiencing homelessness last year was 14,000. So 7,000 of the 14,000 people that you see homeless, that's half. And they have a serious mental illness, and they're entitled to benefits under our state Medicaid agency access, including supported housing. But there just has not been the level of investment so that there's an inventory of the housing that's needed to give them that kind of stable housing.
So what's the solution? How do you solve that problem?
Yeah. So Access, our state Medicaid agency, is now embarking. Finally, they put in a waiver to the place called Center for, basically the federal government, asking them to implement what's called an H2O housing initiative, where they're going to do a concerted effort to get those the people that are cycling most into emergency departments and long-term stays, the most expensive segment of that population, into supported housing. So Access is asking for $5 million this year at the state legislature to help. We're going to draw down $15 million from the feds because it's a match program. And then that would go into a program where they could start to bite off some of this. It's not going to all happen at once.
Yeah, that's a lot. 7,000 is a lot of people. So do you believe that the expense is offset? The solution would offset the expense that we're already spending on this cycle.
Yeah, it's Access, actually, there's an infographic which I was going to send to you, but I ran out of time this morning, that shows it depends on the kind of expense, but it's about a 40% reduction in costs once they get into supported housing. So this isn't just a welfare program to get people. This is a program to get people some stability so that they're less expensive in the correctional system, the inpatient hospital system, in the emergency departments, and all those other really expensive long-term stay places, because it's a lot cheaper to be in a stable apartment, a behavioral health group home, that kind of residential environment, than it is some sort of inpatient facility or jail.
And will they be able to, or some of those people, are they able then to move eventually out of that housing and into self-sufficiency with the right medication and treatment?
Yeah, many people, yes. You get stable housing, stable meds, good psychiatrists, they find the right medication, good family support, then you can start, that's called recovery. You start to be able to transition into independent living, maybe even going back with your parents, maybe even living on your own, a lot of them. So it's a process. It doesn't happen overnight. It's not like a sinus infection like I sort of have. This is a longer term thing, and so it takes a while for the meds to kick in. But if that stable housing piece isn't in place, that's when you get what you look in the street and you say, this doesn't look right.
Right.
Something's wrong with this person. And many times, half of them, you're right, it's a serious mental illness where they don't have stable housing.
Oh, I think we both agree that I'm glad that we're starting to wake up and talk about all the aspects of this. And I really appreciate your expertise, and it's always been fun to talk with you. And what I would like to do is set up another time that as this moves along, that we talk about the ins and outs of the program.
Yeah, my pleasure. Thank you.
Thank you so much. All right, we'll be back.